Well, there are more reasons to have cataract surgery than just improving your vision. You may be surprised to learn that cataract surgery can actually help you live longer and reduce your risk for developing dementia. So Dr. Mark Stevens of Key-Whitman Eye Center is here to explain how. Good morning, Dr. Stevens. This is fascinating. Yeah. Let's talk a little bit about how cataract surgery, of all things, can help somebody live longer. How does that work?
Sure. So some research studies have shown that patients that have had cataract surgery have an increased life expectancy. We know that with cataracts, your vision slowly decreases over time, and with that loss of vision, you're more prone to accidents. And whether that's car accidents driving at night, driving in the rain, or simply accidents like not seeing the stairs maybe as well as you should to get that last step, or seeing a curb walking up to the doctor's office. Those big traumas at a older age are really difficult to recover from and can lead to a downward spiral of health.
Well, now that makes such logical sense. Being able to see where you're going does help obviously reduce these kinds of accidents.
Sure.
But a lot of us are also very, very concerned about brain health. And you also say that cataract surgery can help prevent the onset of such ailments like dementia.
Yeah, so a study in 2021 published in the New England Journal of Medicine showed a decreased rate of dementia in patients that have had cataract surgery. We know that part of dementia is a decrease in sensory information into the brain, and with cataracts, you're decreasing that visual information that the brain deals with.
Okay.
On top of that, cataracts make it more difficult to do the hobbies you like to do, whether that's reading a book or sewing or playing golf. You just decrease those activities and the brain's not as active. In addition to that, with cataracts, we tend not to want to drive as much at night, so maybe we're decreasing our social engagements. And we know that social interaction is so important for brain health as we age.
All right, it's kind of like flexing a muscle. If you don't use it, then you kind of lose it. And it's the same thing when it comes to, if you're not seeing things, your brain is not exercising that component of its capacity, and that can really cause some issues. That's interesting. So when do patients know that it's time to consider surgery?
Well, sort of our normal progression of eye health is we typically start seeing patients in their 40s. We all tend to lose that near vision ability around 45, 46. We start needing reading glasses, and that's the lens inside of the eye starting to harden up and no longer being flexible. As we hit 60 to 70 range, that lens starts to turn yellow, and that's what a cataract is. As far as when it's time for cataract surgery, pretty much when you're in your 60s and 70s, you're going to have some cataract. But what we really care about is how does it affect your activities of daily living? Meaning, are you driving as easily as you like to? Are you reading? Are you watching TV? Do you have any decrease in your ability to do those activities? Once that becomes evident, it's pretty much time for cataract surgery. Okay,
so let's also talk about getting a comprehensive exam. Let's say that it's been over a year since you've had a comprehensive exam, and you're starting to notice some differences in your ability to read, whether, having long distance reading or short, you're seeing some changes that are concerning to you. When do you know that it's really time to make that call and go in for an exam?
Well, anytime you're seeing changes, we recommend you get an exam. We have 9 locations located throughout the Metroplex. If you'll simply call the number, we'll get you in as conveniently as possible for you.
Fantastic. Thank you so much for this, Dr. Stevens. We really do appreciate it. All right, you can call 214-220-3937. That's 214-220-eyes. Again, that's 214-220-3937, or visit keywhitman.com for more information. You definitely want this as an opportunity to really have both being nearsighted and farsighted. Both of those can be addressed, as well as you have issues related to cataracts. You have lots of different options when it comes to calling Key-Whitman, so give them a call today. Jane?